OK, they say mother knows best. In one hospital in Wales, mums are volunteering on postnatal wards to help others who've just given birth.
It's part of a maternity buddies scheme where volunteers do things paid staff might not have time to, like chatting to new mums, picking up packs of nappies and carrying meal trays.
It's not just mothers getting involved. Grandmothers, students helping out too, as Jenny Hill's been finding out.
He's just a few hours old. And new mum Naomi has plenty of questions.
Did you have a normal delivery?
Yeah. Helping her out is Karen. She's not a midwife or a nurse, but she is a mum herself.
There may be things that they would maybe feel are very small things they wouldn't want to bother the midwives with, just sort of thinking, oh, is this normal? And just having obviously had 2 children myself, you know, just to be able to reassure them and say, yes, this is fine. If it's not, to go and get a member of staff.
There we go, I'll leave it by here.
They call them maternity buddies. They listen, support, fetch and carry, but they have no clinical role. In fact, they're not even allowed to change a nappy.
We have a very clear set of definitions for maternity volunteers. They're in no way there to replace paid staff. It's really nice to have that more intergenerational working, that rich life experience of having children and bringing up children themselves, and to coin a phrase used by one of my colleagues, just mothering the mothers.
Nearly 4,000 babies are born every year in this part of Wales. The birth rate across the UK is rising, and that means maternity units like this are busier than ever.
Concerns about a shortage of midwives have been raised across the border in England. Already at least one trust there is using a similar volunteer scheme.
Of course there are concerns, because I think we always have to be mindful that any new role that comes in, and just in some areas volunteering is not a new role, it's been happening for ages. But where that happens, we have to be clear that they're not replacing other healthcare staff.
For some of the volunteers, this is valuable work experience. Alison's a teacher, but plans to retrain as a midwife.
Because I had my 3 children and they were all born at the Royal Grey Hospital, and I had 3 very different births as well, so I can you sympathise with the mums because you know how they feel and how you felt when you were in hospital.
Here they say volunteers can't and won't replace trained professionals, but Karen and her colleagues do offer a quality that's in short supply on these wards: spare time. Jenny Hill, BBC News, the Royal Gwent Hospital.
So joining us now, Tim Day from the Wales Council for Voluntary Action and Elizabeth Duff from the National Childbirth Trust, who's in our London studio. Tim, lots of good, positive things to say about this, but I can imagine that some people might be thinking, who are these people? How well trained, how well prepared are they?
I think that's a very good point. Any hospital, and indeed there are many hospitals which take volunteers in a whole range of different roles. This is one very good example of that. Any hospital should make sure that the volunteers are properly managed, properly inducted, properly trained, and in the first place, to be honest, properly selected. It's not just about taking any old individual who wants to be helpful and dumping them on a ward. It's about making sure that they are properly and effectively prepared for that, and that they're the right person.
Elizabeth Duff, are you convinced that those safeguards, if you like, will be in place?
As far as I've heard, I think the whole selection process sounds good, and I gather the volunteers are CRB checked, which obviously is essential when they're in touch with women and new babies. And I'm sure that with this scheme, a vast majority of women are really pleased with it, and it's lovely to have some more people about to give them a hand and have a chat and just be there, because we know from feedback that women on postnatal wards often feel really a bit abandoned, and that there really isn't anyone about to give them a bit of emotional support.
Volunteering is clearly something everyone applauds, and there's a mantra at the moment of volunteering and how it's a good thing to do. But if there is work to be done on a hospital ward, I mean, people should be paid to do that work. And is there a danger, I wonder, Tim, if I could ask you that, is there a danger that inevitably that this will slip into those volunteers ending up doing things that it wasn't envisaged they should do in the first place?
No, I don't think that's inevitable at all. I mean, for example, WCVA, the organisation I'm with, has a charter with the Wales TUC, and part of that charter is about saying volunteers will not take on work that is done by paid staff. So it's not a matter of replacing paid staff with volunteers. And certainly the Betsy Cadwallader Local Health Board up in North Wales, they have a very clear understanding, written understanding.
Well, can I just ask you, I mean, we mentioned the lead-in, carrying trays. Well, who carries trays now if it's not a volunteer? Somebody does it, presumably.
You will find in each hospital that there are different people who have particular responsibilities for things. The crucial thing is the word negotiation. You need to sit down with the hospital, with the unions, with the staff, in order to work out what is the best way of that, drawing up that delineation.
I just wonder, Elizabeth, whether that might lead to potential confusion if you're a new mum. Perhaps you're experiencing some pain, perhaps you're experiencing problems with breastfeeding. You've got this lovely maternity buddy sitting next to you and suddenly she says, can't help you with either of those things. I mean, I don't know where the delineation is, but if it is around those issues, that could be confusing and upsetting.
I do agree with you, and I think with the best will in the world there are going to be some problems like that, because women often have a number of concerns about the baby, their own health. As you say, breastfeeding is extremely important, and it's absolutely key that women get the right support to start with. And as you're saying, if they start a chat with a volunteer, obviously there's a relationship being formed, which is great. But if the woman goes on to, in the course of the conversation, start talking about something that's really worrying her, it's then really quite unfortunate if the volunteer has to say, stop there, I can't listen to you anymore, I've got to go off and find somebody. And that can really be quite disruptive, and then a midwife who's perhaps quite busy elsewhere has to rush in, and that's not an absolutely ideal situation. I should say I've read a few things about this service, which in many ways sounds great, but it describes it as freeing up midwives to do clinical care, and I think that's just a little bit of a misunderstanding. Midwives, it's pretty clear in Welsh policy. I've seen documents signed by the Chief Nursing Officer for Wales really making clear that midwives are health and social care professionals. And to me that does mean being with women, listening to them, not just about where they've got something that needs addressing by clinical care.
OK, Elizabeth Duff from the National Childbirth Trust, thank you. Tim Day from Wales Council for Voluntary Action, thank you both very much indeed.